Hello, how are you? In today's video, I'm going to talk to you about the main symptoms of high blood pressure, that is, arterial hypertension. You might have high blood pressure and not even know it. The World Health Organization estimates that 1 billion people worldwide suffer from high blood pressure or arterial hypertension, but only 1/3 have actually been diagnosed. So, you might still be in that group that suffers from high blood pressure or at the moment has hypertension and doesn't know it. My goal with this video is to help you understand these symptoms. And it could also be that you're already undergoing treatment, but you still have these symptoms because the medication dosage or what you've been doing isn't having the desired or necessary effect. So stay with me until the end, because you'll definitely want to know what these symptoms are. First of all, if you're new here, take a moment to subscribe to the channel and turn on notifications. I post new videos every day and you won't want to miss them. If you happen to know someone with high blood pressure, share this video and help me reach as many people as possible. Let's grow this chain of goodwill together, because that's truly what I want to achieve here with the channel. I've selected these high blood pressure symptoms for you because in my other videos about diet and blood pressure, I have a video on the best foods for high blood pressure and another on the worst foods for high blood pressure, so you can be aware. In the comments on those videos, many people mentioned that they experience certain symptoms and would like to know if they are related to high blood pressure or not. So I decided to highlight the main symptoms of high blood pressure for you in this informative video. I want to make it clear to you that if you experience 2 or more of these symptoms, or if you've been feeling them repeatedly, it's important that you see your doctor so they can guide you further, whether it's high blood pressure or not, and help you with this as well. What exactly is high blood pressure? What is this so-called arterial hypertension? Blood pressure is related to the force with which the heart pumps blood through the arteries, vessels, and capillaries. If your artery, if your vessel, I'm going to refer to it as vessel in general, just to make it easier for us to discuss this here in the video. If your blood vessel has a lot of resistance, the blood pressure will be higher than if it were a more flexible vessel, in which case the pressure would be lower. So, because of this, the heart needs to pump the blood with more force, which puts more strain on the heart in the medium and long term. Normally, high blood pressure is considered to be from 140/90, or as some people say, 14/9. This already characterizes arterial hypertension in most cases. What causes high blood pressure in most people? Usually it is closely related to being overweight and obesity, and it is also associated with a high intake of salt in the diet. In many cases, it is very much linked to a high consumption of alcohol, ongoing stress, and quite often, some people experience what we call nervous hypertension, which can be triggered or worsened by emotional factors. When the person is very stressed, very irritated, going through a difficult period in life. So in this case, sometimes it can be a temporary hypertension related to this aspect, really, of stress, of feeling unwell. So there can be different types of causes that will make your blood pressure go up. Some people think they don't need to worry because their blood pressure is 13/9 and sometimes it goes up to 14. But you do need to be concerned. Ideally, our blood pressure should be around 11 or 12/7 or 8, so it shouldn't be much higher than that. I'm telling you this because high blood pressure is silent. Most of the time, the symptoms I'm about to tell you about happen at the beginning, and then your body kind of adapts to the increased pressure, and you stop feeling these symptoms. That's why we say high blood pressure is a silent disease. Just like diabetes often is for some people. I even have a video here on the channel talking about the symptoms of diabetes if you want to know more about that. But what I want to tell you is that chronically high blood pressure over many years puts a huge strain on the cardiovascular system in general and on all the systems in our body. I'm going to tell you more about some of the impacts it has because I want to leave you with a message right here at the beginning of the video for you to think about. Just because you don't have a family history of high blood pressure doesn't mean you can relax and never check your blood pressure. It's important that you have regular checkups with your doctor, and if you have a blood pressure monitor, it's a good idea to measure it from time to time to see how you're doing, especially if you're going through a tough time at work, in your marriage, or with money. If you're more stressed or dealing with a problem that could raise your blood pressure, check it from time to time, turn on that yellow warning light, because even if you don't have a family history, you might still be going through a more complicated situation like this. If you already have a family history of hypertension, it's very important to monitor this closely so you can see where you stand in that regard. The first symptom of high blood pressure, of arterial hypertension, is a headache, especially that headache you feel back here in the nape of your neck. Many people with high blood pressure, because of the increased effort of the blood, the higher pressure, especially in the vessels that go to the head, that supply the head, these vessels are more affected by the increased pressure and cause you to have headaches frequently. Often, this headache is already present in the morning. The person wakes up with a headache. So if you have been experiencing recurring headaches, stop taking medication on your own. People have a habit of doing this. They think a headache is nothing, take some medicine, and the pain goes away. If you are experiencing constant, frequent, or recurring headaches, you need to see your doctor to find out why this is happening. If you are not able to see a doctor right now, if your appointment is only scheduled for a month from now, start monitoring your blood pressure at home. Go to a pharmacy if you don't have a blood pressure monitor to see if this elevated blood pressure is related to your frequent headaches. High blood pressure can also cause signs like drowsiness and mental confusion. Some people have trouble reasoning or remembering what they were talking about, and this, once again, is related to the blood flow going to the brain. So if you have been feeling very drowsy, even though you sleep well, it could be that oxygen is not reaching your brain as well as it should. If you often feel very confused or sometimes can't remember what you were saying, this can also be a non-specific sign of high blood pressure. Some people also experience nausea, dizziness, and ringing in the head. This is because many times this nausea and dizziness are related to that initial headache I mentioned earlier, which is the most classic symptom. But also, because circulation is impaired and nutrients and oxygen don't reach the brain as easily, this affects the proper functioning of the body. Even the blood flow to the ears can cause ringing. So pay attention to anything unusual, especially in the area of your head. At the onset of high blood pressure, when it first starts happening in your body, your system tries to adapt to this increased blood pressure, and you begin to experience more heart palpitations and cardiac arrhythmias, which in the medium and long term are very harmful to the cardiovascular system. So if you often feel like your heart is pounding out of your chest, as we say, if you have a lot of tachycardia or frequent palpitations, go check your blood pressure. It could be another sign. Some people with high blood pressure may experience a small hemorrhage in their eyes, showing those visible blood spots on the white part of the eye, almost as if there had been a tiny blood leak inside. They may have double vision or difficulty seeing because of the high blood flow and pressure, since the capillaries in the eye are very thin. So this can impair the proper functioning of your eyes and your good vision in the medium and long term. So, if you start to notice any kind of problem with your vision, if these spots begin to appear in your eyes, that's also a sign you should pay attention to. A person who has high blood pressure for a long time, poorly controlled, can even develop kidney failure because this large amount of blood with very high pressure also reaches the capillaries in the kidneys, which are responsible for filtering our blood. They can impair the proper functioning of the blood and harm the proper functioning of your kidneys, which is very important for our health in general. So, once again, if you've been having any kind of kidney problems, it could be a symptom of hypertension that you haven't noticed. If you are overweight, if you are sedentary, if your daily diet includes a lot of processed foods, a lot of bouillon cubes, a lot of soy sauce, a lot of salt, it's possible that you may develop high blood pressure, or you might already have it, because this is an environment that favors increased blood pressure, which is bad for you. So, if you have this kind of lifestyle, I suggest that you start monitoring your blood pressure to check how it is. In a large number of cases, people are able to regulate their blood pressure just by making some lifestyle changes, improving their diet, increasing physical activity, and making better choices in their daily lives. So I'll leave for you down here in the video description the link to some videos I've already made on the channel about blood pressure. Recipes for blood pressure, teas, tips on how to lower your blood pressure naturally, good foods and bad foods, as I mentioned to you at the beginning of the video. Take a look at these videos. They might help you. Always remember that if you already have high blood pressure, have been diagnosed, and are already taking medication, never stop taking it on your own just to follow these tips, because that could put your health at risk. The most important thing regarding your medication is that it was prescribed by your doctor, and only your doctor will decrease, increase, remove, or add to it. So let's not mess with that. And now, tell me down below, what symptoms do you experience when your blood pressure is high? If there are any symptoms I didn't mention here, but that you feel when your blood pressure is elevated, let me know down below, because by doing so, you also help other people who are watching the video. Speaking of helping, share this video with anyone you know who has high blood pressure so I can reach as many people as possible. That's what I want here on the channel. Like the video too, because that also helps me out here. And if you're new here, don't waste any more time. Subscribe to the channel now and turn on the notification bell. I have new videos every day about symptoms of various health conditions, nutrition tips to help you treat them, what makes you gain or lose weight, different diets. I share recipes. You're going to love them. See you next time. Bye.